Good afternoon. Thank you for joining us today for the fifth discussion in our Change Starts Here webinar series. This series builds on the work of organizations and communities supported through Brooklyn Community Foundation's Brooklyn COVID-19 Response Fund. I'd like to share a few logistical notes before we get started. Throughout our session today, please submit any questions that you have in the Q&A box. You can find the Q&A box on the bottom of the screen. We will address your questions towards the end of the webinar. We also have live closed captions available. Please look at the bottom of your screen to turn those on by clicking the arrow on closed caption and selecting show subtitle. Throughout the webinar, you can look back at what has been said by clicking on view full transcript, or adjust the size of captions on your screen by clicking on subtitle settings. I'd like to share a few words about the Brooklyn Community Foundation. Founded in 2009, we are the first and only public foundation dedicated to New York City's largest borough. Everything we do is rooted in our explicit commitment to racial justice. To date, we have granted more than $60 million to vital organizations working across our borough. We launched the Brooklyn COVID-19 Response Fund in early March 2020, and it was among the first funds nationally to prioritize addressing the pandemic's impacts on Black, Indigenous, and other communities of color. In the first phase of this work, we distributed $3.3 million through 420 grants to 246 organizations across our borough, thanks to the generosity of more than 1,600 donors. Our second phase of grant making is bringing the fund's total commitment to nearly $7 million. We continue to fundraise for our Brooklyn COVID-19 Response Fund because we know that there is still a long road ahead. The systemic inequities exacerbated by the pandemic will not disappear when the pandemic subsides. We began phase 2 last fall with Brooklyn Insights 2020, an 8-week community engagement process to learn from and partner with the communities most impacted by the pandemic in order to identify and invest in community-led solutions to achieve structural change, as well as address urgent ongoing needs. We recently released our report on Brooklyn Insights 2020, which you can view at bcfny.org/COVID-19/phase 2. As part of our second phase of our Brooklyn COVID-19 Response Fund, last month we announced 25 grants of $10,000 each for grassroots nonprofits providing access to culturally relevant, medically accurate COVID-19 education, outreach, and navigation support for COVID-19 related health services. These grants, which total $250,000 of investment, provide targeted support to organizations serving residents disproportionately impacted by the pandemic in our priority neighborhoods of Bedford-Stuyvesant, Brownsville, Bushwick, Coney Island, Crown Heights, East Flatbush, East New York, Flatbush, and Sunset Park. We are honored to be in conversation today with a leader from an organization from this cohort, Jairo Guzman, as well as New York City-based physicians, Dr. Oni Blackstock and Dr. Torian Easterling, to discuss vast inequities in both treatment and vaccination during the pandemic, in the context of a system that has historically abused and neglected Black, Indigenous, and other people of color. Also, we want to look at the steps that need to be taken now to repair harm, build trust, and ensure self-determination in care. Dr. Oni Blackstock is recognized as a thought leader and influencer in the areas of HIV and health equity. She is a primary care and HIV physician and founder and executive director of Health Justice, a consulting practice that helps health organizations to center anti-racism and equity in the workplace and reduce health inequities in communities they serve. Dr. Torian Easterling serves as the first Deputy Commissioner and Chief Equity Officer at the New York City Department of Health and Mental Hygiene. Dr. Easterling is a community physician committed to health equity, social justice, and movement building to achieve the health outcomes that all people deserve, both locally and globally. Jairo Guzman is the founder and president of the Mexican Coalition. As president of the Mexican Coalition and director of Coalición Mexicana, he is charged with the mission of service of each organization and achieving their binational goals. I'd like to invite all of our panelists to come on camera for our discussion. All right, it is so wonderful to have you all with us. So I'd like to start with a question to everyone, and I'm going to go to Jairo first. We know that COVID-19's health impacts, cases, hospitalizations, and fatalities have been most severely felt by Black and Latinx communities. And now we're seeing persistent gaps in the vaccination rates between white residents and Black and Latinx residents. What does vaccine equity really mean? What does that term mean to you? Jairo, I'd like you to respond first.
Well, thank you for inviting me to be part of this panel. It's a wonderful conversation for us to be having, particularly now when there is a greater sense, at least among the community we're serving, with regard to how safe the vaccine is, and therefore how should, where and how does our community get engaged and ultimately accept the vaccine. I think when we refer to equity, we are forced to look at some of the challenges that our system of care has in the city of New York, and some of these rely upon other systems of care. Right? You know, when we are serving right now the Sunset Park area of Brooklyn. In March, we did a survey, a community survey with 115 persons who participated, and less than 70% of our community there have a high school diploma. Less than 70. 10% of them don't have any kind of formal education. Okay? For us to begin to talk about them being engaged in the healthcare system requires that we provide them formal education, that we help them become really educated. For us to engage in equity, it can't just be the vaccine at the moment, which is right now the flavor of the month kind of a thing, right? And so we really do need to work on some of these challenges. And so when we talk about health equity or vaccine equity, a lot of the challenges is how do we work with our community, and and these are some there are some structures here with regard to are we engaging our community where they need to be engaged? But some of it is much more profound. It goes directly to trust. Does our community trust the systems of care and who's running some of these systems? And so engaging in a conversation around equity requires for us to look much, much closer to multi-systemic needs.
Thank you, Jairo. I feel like that's really great framing for the conversation. We're talking about trust. We're talking about understanding that COVID-19 and vaccines are not separate from the broader issue of our healthcare system's history, health equity more broadly, and access, right? Like access to information for people coming into the conversation at different levels of information and education. Dr. Blackstock, let's go to you next. I think Jairo has given us great framing. You work directly in the health equity space and with organizations doing this work. Can you talk a little bit about health equity and vaccine equity in that respect?
Sure. Thank you again for having me. It's such an honor to be here on this panel. And no, I agree with Jairo's point around like the vaccine is really just a micro point. But really, I think when I think of vaccine equity, it's about really ensuring that the access that communities have to the vaccine is commensurate with the impact that the pandemic has had on those communities. So, if we're just looking at numbers, like it's not sufficient to just see, the proportionate sort of the proportion of the population that has been vaccinated being similar to their representation in the population. That's not enough. It needs to be greater because we have certain communities having disproportionate impact, being disproportionately impacted by the pandemic. But it's also ensuring that people have what they need to get the vaccine, right? So like making sure that it's a welcoming environment, making sure that people are speaking a language that people are familiar with, people have transportation, people have whatever emotional support, care coordinators, navigators, whatever it is, to meet their needs so that they feel that and they know that they matter and that they're being valued. So that's what I think of when I think about vaccine equity, but it can be obviously generalized to health equity.
Yeah. And I love that you take us to the very like individual examples of what that access and equity can look like in the life of one person, but also um, on a more systems level, how it needs to exist and where those investments need to be made in line with where the damage has been done and where the neglect has really been shown. Dr. Easterling, to you, health equity, you are part of the city's, leading the city's response to the pandemic and increasing vaccine uptake and availability and access. Where does vaccine equity come in, and what does that mean to you from the perspective of being a community practitioner in your own right and also helping to lead the city response?
Yeah, no, great start to the conversation. Thank you, Marcella, for moderating and leading us through into the Brooklyn Community Foundation, for just even creating the space. And certainly it's great to see my esteemed panelists who I've worked with over a number of years. And I think, just to build on what's already been said, because I certainly agree both with Jairo and with Dr. Blackstock, grounding this in trust, but also, grounding in what we already know. And Marcella, I think you talked about the trauma that already exists, right? And so equity has to start at the very beginning, and often it does not, right? And I think transparency to that conversation is saying that we did not start with equity from the very beginning of this pandemic, the very beginning of this rollout. And so really grounding in that space and acknowledging that, we already have this history of a mistrust, right, of discrimination and bias that shows up in our governance structure. And if that continues to be the direction and path that we will follow on, these outcomes are going to happen. And so we don't want to wait for these outcomes, right? And so equity means we have to have a different conversation than we've had previously, and how we provided services and how we looked at our data and how we think about our policies. And so, starting with compassion and trust, thinking about inclusiveness, and sort of hearing, what Dr. Blackstock is saying, like, we need to think about the populations who we need to center. And many of those populations, we know, we're not just talking about neighborhoods, and we're not using place as a proxy. We need to get more explicit in who do we need to serve. And if we're not intentional that way, we're not going to achieve equity. And so that means that we have to really uproot a lot of the structures and systems that have already been in place. And we need to think about those policies that will sustain those changes. And I think that's where we can really talk about the direction of getting to a new normal, a new place in which we want to arrive at, but sort of just trying to have a different outcome in sort of the same structures that we sit in is very challenging. Certainly an uphill battle, and everyone on the panel knows that.
Yeah. Yeah, I mean, I think you place us in the conversation right where we need to be, right? Acknowledging the historical legacy that this pandemic landed on, right? There wasn't a clean slate to just, okay, we need to respond. No, there's history there. We need to be honest and transparent and responsive to that. And now you also mentioned kind of looking forward to trying to create a new normal and what that might look like. Can you give us an overview of where we are right now? What are the current numbers for COVID in Brooklyn? How are we doing with rates of infection and hospitalizations? How are we doing with vaccinations compared to other boroughs? Where are there areas of neighborhoods of concern, and what is the city doing to help and respond to that with equity at the center?
Yeah, certainly. And really happy to say that we're certainly in a much better place than we were a month ago, 3 months ago, particularly with our COVID milestones. And also happy to say that, across the country, that we are seeing rates, case rate and, percent positivity decline in all 50 states. And so I think that that's important, and that's a place to start, that there's movement and the vaccinations are working. Certainly I think that we have to pay attention globally because we're not seeing the same declines in certain areas. And I think that gives pause, and we certainly need to also be wary and cautious about what we're seeing more globally, particularly with transmission and the variants. But to your specific question, here in New York City, we're seeing declines in all of our major milestones. So that's our percent positivity. Right now, we're at 1.41%. We haven't been here for quite some time, since last summer. We are seeing a decline in our case rate in new cases, and also thinking about hospitalizations and deaths. So that's where we want to be. The focus now is, mask and distancing helped us get to a point where we can really have this conversation, and vaccinations are really going to get us to the end of this pandemic, but we have to keep our foot on the gas. So, our COVID-19 public health milestones are trending in the right direction. However, there are neighborhoods that where we are still seeing higher rates of cases and percent positivities in certain neighborhoods, and certainly Brooklyn, neighborhoods that have been disproportionately impacted, like East New York and Brownsville, do have a higher percent positivity than the rest of the borough. And the borough is at 1.47% as far as percent positivity, and certainly higher than citywide. And so certainly we need to keep mindful of certain neighborhoods. And when we look at the percent positivity and other factors, certainly the things that we paid attention to. And so these are neighborhoods that, that you had higher rates of frontline essential workers. You already had higher rates of health status, that underlying chronic conditions that led to severe illness related to COVID-19. And then when you couple that with lower rates around vaccines, full doses, full vaccination rates, that's also a concern. And so wanted to make sure that we continue to prioritize the neighborhoods that have had, borne the brunt of this pandemic. And so, for citywide and the borough of Brooklyn, we're over 7.6 million doses that have already been administered across the city. Certainly we need to do more, at least one dose. We're about over 4 million doses, and for both doses, certainly need to do better at getting those numbers up citywide. And then, for the rate, as far as the Brooklyn, about 40% of adults have at least one dose. And I think that's, certainly in the right direction. But again, there are neighborhoods that have lower vaccination rates.
Right.
So that's what we're continuing to pay attention to. And then when you say, what are some areas of concern? I think one, the lower vaccination rates continue to push forward there, but also paying attention to variants and the presence of those variants, and presence of being of folks who are not vaccinated, either not fully vaccinated or unvaccinated at all. And so that's certainly a concern, and we're going to have to continue to keep an eye on that.
Yeah. Thank you for that overview. And you give us a lot of really exciting and positive news, right? Our positivity rate is much lower than it's been in a very long time. And so that's something that we definitely want to acknowledge and celebrate everybody's efforts towards making that happen. And we're seeing a lot of positive impacts of vaccinations, right? Cases going down, hospitalizations going down. And yet we have a lot of people who remain unvaccinated. And Dr. Blackstock, I'm going to come to you first and then ask Jairo to come into the conversation. In New York State, we're just a couple of days away from adopting the CDC guidance around masking and social distancing for public settings and most businesses for people who are fully vaccinated. And just, I think, weeks away from a much fuller reopening in the city and state, right? And so on one hand, we're holding that reality while also acknowledging increasing variants, taking a more global view, as Dr. Easterling has encouraged us to do. What's your biggest concern, Dr. Blackstock, as we look at these, kind of holding all of these things together, right? What does that mean for us?
Mm-hmm. Yeah, no, it's such a great question. And as you were describing all of the reopening, I could sort of feel the sensation in my chest, like that I often associate with anxiety. Like, I think just thinking about the reopening and obviously the CDC guidance that was recently issued, I think probably caught a number of people off guard, and understanding sort of what are some of the motivations behind that. For me, I'm, concerned that many people, particularly people from communities that have been most impacted, those that are most vulnerable, are unvaccinated and may not always be in situations where they can protect themselves. So people who, are having to, who've continued to work throughout this pandemic, people who have to go back to work in situations where they don't have the protection that they need. So that really concerns me, as well as just the fact that we haven't really corrected many of or addressed the structural issues that led us to this situation to begin with. And I think like the most proximal being just thinking about like investment in our public health infrastructure. We don't have a public health infrastructure. We have, public health departments, and, we're fortunate that the leadership at the New York City Health Department, is excellent and outstanding, but that doesn't always make up completely for the fact that we don't have like a coordinated system of agencies that are working together. And so, obviously that I would hope this would be an opportunity for us to further invest in that. So I'm worried. Yeah, I'm just worried about folks who are not able to protect themselves. And just to say, like, a colleague of mine tweeted this a few days ago when the CDC guidance was released, saying, if you just looked at subgroups, so he looked at like Black Americans and Latino Americans and looked at the vaccination rates in those groups as opposed to looking at the overall vaccination rate, would it have made sense to introduce these guidelines with having people, go unmasked if they've been vaccinated? And it's true, and it's likely that it would not, that would not be the case. And so it feels like some of the guidelines and what's happening is really not taking into account the vulnerable position that many Black and Latino communities are in.
Absolutely. And Jairo, you're coming from the perspective of Sunset Park, very much embedded in community work and trying to increase awareness and engage in conversation with community members about staying healthy, masking, social distancing, vaccinations. And on the 19th, New York State is going to tell everyone, you can unmask, you can socially distance, new guidelines around how to interact in public. And as Dr. Blackstock has really focused in on, is that our communities, whether it's Brownsville or Sunset Park, our vaccination rates are not there yet, right? The level of safety that it implies, this just not reflected in the data when you look at a community level. So Jairo, what are you concerned about? And what is the response from the Mexican Coalition and in Sunset Park?
Well, thank you. I think everything that has been said is so true with regard to how a community could react. And what we're seeing in the community we're serving is a clear message from them saying, we're getting mixed messages. We were already confused, right? 76% of the community we've been serving in Sunset Park mentioned that they were not sure they were getting the right information. And many of them were saying also that there was lack of information with regard to it being in the appropriate language. When we look at who lives in Sunset Park or in Brooklyn, and you wind up looking at sub-communities, and I'm referring to, in our case, to the indigenous communities, that they were completely left out of reaching them and engaging them. 44% of our community mentioned that they were simply not sure that they were getting enough information or the right information. And on top of that, we had about 69%, about 40% of our community who were saying they simply did not trust that the government was being completely upfront with regard to what COVID was in the vaccine. So now we have now we have the CDC saying, hey, you can now choose not to wear a mask, and we're doing it on trust, right? There isn't a system that is going to actually verify if the person sitting next to me without a mask has actually been vaccinated, right? So we do have a number of folks, and for our community, who is primarily the non-essential unsung worker, right? These are the delivery persons who are going door to door delivering food to those who have the means to not be a risk or as a greater risk. And now we have an institution that everybody looks to as the institution to provide guidance, saying, by the way, everything that we told you before, it's now optional. Okay. And that's what we're hearing from our community with regard to these mixed messages. You know, who do we trust? We weren't sure we were able to trust the government. We weren't sure they were already certain that they were not saying the full truth about the vaccine and around what COVID is all about. You know, part of the work that we're doing with Brooklyn's Community Foundation support is trying to engage our community with videos that combat misinformation videos that our community is seeing. You know,
Yeah.
I think a lot of our folks, there might be a sentiment that immigrants, when they come here, they get disconnected from their native country. And in fact, they are even more connected to their country.
Mhm.
And when it comes to COVID, they're getting tons of videos of misinformation with regard to how effective wearing a mask is, how effective was social distancing. And so having again on the 19th now, you know, tomorrow now saying everything is optional, just goes backwards with regard to what we're trying to do in trying to help people understand that there is a real positive to some of the stuff that we were doing prior.
And Jairo, I think it's so interesting, right? So Brooklyn Community Foundation is very excited and really proud to be partnering with Mexican Coalition through our community, our Brooklyn Community Health and Outreach grants, to help support these really innovative projects, right? You describe, and again, centering the conversation on trust, a deep trust for information coming from the home country of some of your community members, but you all are aware that this information is not valid, right? Is misinformation. It is confusing people. It is leading them, you know, kind of to have their decisions be informed by something that isn't true. But there's deep trust there, right? And now we have here information that is coming not totally accessibly to community members more generally, but there's a lack of trust. And Mexican Coalition is kind of sitting at that intersection of valid information, trust from community members, awareness, you know, of a more global kind of view of the situation and all these different dynamics that are informing individual members, kind of how they're making decisions for themselves and their families. Can you talk a little bit more about, like, what does that look like in your work? The projects that you describe, I think, are really great. You understand that video is the medium that speaks most powerfully to your community members. And so you're creating these videos to combat the misinformation in videos that they're watching. Can you talk a little bit more about how Mexican Coalition is developing and maintaining that trust so that they are the trusted messenger to combat, you know, what's coming from the home country of some of your community residents?
Yeah, sure. You know, one of the things that we've been working very hard, you know, we work very closely with the Mexican consulate, the Central American consulates, and other Latin American consulates, for them to also be able to understand how closely we're working with our immigrant communities right on the trenches, right? And what we're doing is we're making sure that we're getting information. So the Mexican consulate gives us boxes and boxes of printed material that is being produced by the health department in Mexico for us to inform our community about what what COVID is all about. Okay.
Yeah.
We have community ambassadors, and this is thanks to the Department of Health and HHSC, who has been willing to fund us hiring persons who look like us, who speak like us, and in some instances, persons whose immigration status is similar, very similar to the community we're serving, right? So there's a narrative that they bring with them that it immediately catches on and creates a bridge to trust. We are producing videos, and we're actually hiring neighborhood residents who speak the language to be the ones who are being recorded and delivering the message, because they are the, you know, and I, working with the Mexican consulate, they were very quick to suggest and offer professional translators, right? And they were willing to, we'll have Mexicans in Mexico videotape, and then you can release these videos to the community. And to us, no, we wanted someone who was in the neighborhood, who who had more of a connection to it, because they're also the ones who are going to tell their friends, hey, I did a video, look at it.
Yeah.
Right.
Create
And I think
ambassadors, right?
correct.
In the
And
process.
and that's what we want. We want to be able to have them be the messengers.
Yeah.
We want them to be the ones calling on their friends and saying, hey, I did this. And we also want to show that we value their work. So we're paying them. It's not just be a volunteer, right?
Yeah.
We're saying your work in this is valued.
Absolutely.
And I think these things are extremely important, because often leadership of systems of care forget that the work that gets done on the ground, it's valuable. It
Yeah.
costs money, and we
Yeah.
should be able to make sure that we provide persons, particularly now when we know that many of our families are struggling to meet so many demands, economic demands. So making sure that we have the financial resources to be able to provide them something, it's important.
Yeah.
So again, we're developing these videos. We're providing them through WhatsApp, because our community uses WhatsApp. I think we might be one of the very few countries that has yet to adopt WhatsApp as the primary means of engaging in digital communication when it comes to
Yeah. Yeah.
engaging our community. But we're sending 500 messages through WhatsApp every week, and videos, and making sure that our community understands that we understand this. And we're not only sending the messages to our Brooklyn residents, we're sending the messages also to Mexico, to Guatemala, to El Salvador, to Honduras, because we know they're going to come around.
Absolutely.
We want to make sure that family there, when they are speaking to family here, are also engaging in the same conversation.
Yeah.
Just this past weekend, we had a whole a pop-up clinic for vaccination, and we engaged a lot of the conversation not on what's going on here. I don't recall a moment when we talked about what was going on in New York City. All of our conversations were what was going on in their country, what was going on in Mexico, what is going on in Guatemala, El Salvador, and Honduras.
And was that compelling people to get vaccinated? This more kind of international view of what the pandemic is doing?
It gave us an opportunity for us to be engaging. We offered the J&J vaccine. So and the media did a horrific job in supporting the effort of making sure that J&J was accepted once more. They, if anything I can say about media, they did better than COVID in killing an opportunity for us to vaccinate folks. Okay. But centering the conversation around, look at Mexico and how the lines stretch for blocks. I spoke to a cousin of mine who mentioned that two seniors got hit by a car on Thursday in Mexico while they were waiting for the vaccine. They're fighting for it. In Ecuador, persons are lining up and they're getting injected with water, thinking that it's vaccine. And so we bring this to the table, and we're saying, hey, why are they so interested in it, and you're thinking about it?
Right. So you're able to kind of highlight it as this coveted resource.
It's an opportunity.
Yeah.
It's an opportunity that your families want to have, and you have it. How do we make it work? And for some of them, you say, you know what, you're right. I'll come in and I'll get vaccinated. For others, I hadn't thought about that. Wait, let me think about this. And can I call you, and will you set me up with the vaccine? And it's just that if it's not J&J, can you set me up for Moderna? And we wound up doing about 100 appointments also, but I think having that kind of sensibility requires for us to be that close to the community. And I think sometimes that might be the answer.
Yeah. So let's revisit this because again, this is all centering on trust, right? Being able to trust in Mexican Coalition, and even the way you're entering into these conversations, let me think about it, I'll come back, and you continue that dialogue. And also, I think that's a really interesting and concerning example you give with the vaccinations that wound up being water. And so I think there's also a message that you all are sending about encouraging people to trust the healthcare services that are being provided, right? That you're trying to encourage access to. So I want to focus in on that a bit. And Dr. Easterling, ask you, how can we ensure and how can we really encourage community members to have better access to healthcare professionals that they do feel that they can trust and feel like they feel respected by? Are there things that the Department of Health is doing? And Dr. Blackstock, I'm going to bring you in after Dr. Easterling to think about outside of the City Department of Health response. How else can that be happening and generating that trust with healthcare professionals?
Yeah, no, I think it's an important discussion and question. And I don't think that we have all the answers, but I certainly think that we have lessons that we've learned during this rollout, lessons that we've learned prior to this pandemic. But I think what we really need is the commitment and the courage, right? The courage to think about the policies, the courage to really invest, and to make the decisions that we know are going to help, right? And so what we've seen, with testing and with the vaccine is that we really have to make this as easy as possible. And so there really shouldn't be this question around access, right? You should be able to literally walk out of your door and be able to walk into Jairo's organization or some other organization or to a healthcare system or a provider or a pharmacy, and you should be able to get that answer, right? And so what do we need to do to set up an infrastructure that would really allow individuals to connect to those services really, really easy? That's the infrastructure that we imagine and we envision. We're not there yet. And I think so really starting to have a much broader conversation with community and better understand how folks are coming into this space around health. And if it's going to really stay in this sort of Western approach around how we deliver healthcare, we are going to miss thousands of individuals in the communities that we serve. And we've already heard a bit from Jairo around this. And I cannot tell you the number of town halls that I've been on talking about, well, will elderberry work? Will vitamin C work? Will zinc work? Is golden seed going to be all right? And we got to have a broader conversation around health. And I think that gets to really understanding health literacy, understanding how folks are really engaged and thinking about taking care of themselves and what really impacts what's important to them and impacts their family. And if we're going to sit and sort of this wait and see if they're going to come to me, that's going to be problematic, right? And I think that there have been models with healthcare systems, as Jairo talked about, working with health and hospitals through their test and trace model, really deploying ambassadors. There have been models where healthcare systems have really deployed community health workers to address, unmanaged asthma. And we've seen systems deploy peer navigators to address behavioral health issues. Clearly, the social justice model, and I'm sure Dr. Blackstock will talk about, the work that she has led at the agency to really end the epidemic around HIV and AIDS. So they're examples of how healthcare systems can really transform and transition to really think about much more services beyond the walls of their institutions. And that's the conversation we have to continue to push forward. But then it talks about, well, where is the finance, where's the funding to really support that work, right? So if it's going to stay bottled up in reimbursement models and payment delivery models that really just only support services that are rendered within institutions and not thinking about community health workers and doulas and all the amazing critical services that we know show up in our communities, we're going to continue to have issues, right? And so this isn't really about how folks can access. It's really thinking about how are we transforming this model to to remove the barriers.
Yeah. Dr. Blackstock, jump into this conversation and share your thoughts about, we went from kind of how to develop and encourage trust, right, between individual providers and community members to really understanding the need for more systemic transformation to make that kind of a reality throughout these different healthcare systems and all these different models that can be embedded, not just when an emergency calls, but really fundamental to how healthcare is provided in our city and country. What are your thoughts on that? Oh, you're on mute.
Thank you. Yes, so many thoughts. Dr. Easterling touched on a lot. I mean, there are a few things that come to mind, like, so much, in this conversation around trust. I think, actually this idea of medical mistrust has actually been studied like so much. And I think because it's a newer condition, kind of like COVID-19. But just to say that the focus, instead of being on the communities, really need to be on what the institutions can do to gain the trust of communities. So institutional trustworthiness. So instead of focusing on medical mistrust, obviously as a symptom of racism and all the other isms and phobias, really thinking about what are accountability practices that healthcare systems, public health departments should be having. What does transparency mean? What does community engagement, like real community engagement, look like? And then they're just like all this bigger issues is in terms of, we don't have healthcare for all. Like when we don't take care of community members, it means we are telling them your life does not matter. I don't think there's any like bigger statement or message than that. And so the reality is that we really need to address, these larger policy issues, many of which are like structural drivers of some of the inequities that we see, or we'll just have, again, a repeat or a continuation, I should say, of what the status quo was. So yeah, and I think as Dr. Easterling was saying in HIV, obviously there are peer navigators, there are different models of care that are really about bringing care to the people and meeting people where they are, as opposed to expecting people to walk into the doors of a clinic or a hospital. So really just, as you were saying, really resourcing and funding alternative models. And just one last point, this whole idea of cognitive justice and the idea that there are many different ways and forms of knowing and knowledge. And so I'm just thinking about this whole COVID-19 situation, like the vaccine was studied in a very rigorous sort of Western science, quote, unquote, way, but are there the elderberry, all these other things that people are asking about? We have no idea if these things, or maybe we do know, we're not listening to the right people.
Yeah.
I'm sure there are many other ways that we can care for our communities and address their concerns in addition to the typical healthcare system.
Right.
But we don't know that because that's not supported.
Right, exactly. Yeah, no, those are great points. I want to switch gears and go into our Q&A box because it is on fire. We have a couple questions. I am going to take the first question from an anonymous attendee that wants us to talk about something we haven't touched on yet, which is children. So what is being done to gain trust in communities for children being vaccinated and preparing communities for sub-12 vaccinations estimated to be available this fall? How are institutions like schools being involved? I open that up to anyone. Dr. Easterling, you unmuted first, so go for it.
Yeah. I mean, this is really important because, although we sort of set this goal of vaccinating 5 million New Yorkers by the end of June, certainly we were anticipating that the FDA and CDC at some point were going to be having emergency use authorization for 12 to 15-year-olds. We know that there are additional studies that are looking at even younger children, so that's going to be important. And so we need to continue to have this discussion around how we're supporting informed decision for parents to support their adolescents to help get vaccinated. And so, all the different tools that we've had in our toolbox to get to supporting informed decision, sharing factual information, but really it's sort of showing up, in different ways, right? And so there are several different ways that we're engaging our DOE colleagues, the Department of Education colleagues, to make sure, that we're putting literature in backpacks for those students who are coming in person, and certainly thinking about sort of the hybrid learning, and so making sure that information is being shared virtually as well for parents and also for our high schoolers. And I think also just sort of thinking about our pediatricians. We were really centralized, right, in our vaccine rollout. Large sites, healthcare systems, thinking about pharmacies. retail chains, right? And also thinking about city sites, in state sites and federal sites. But now moving more towards pediatricians. We always knew that providers are a really key messenger around vaccines. This isn't just, it didn't start with COVID-19. We knew in our routine immunizations, flu vaccines, that providers are really important in providing that message. So we've been working with providers across the city, many of them who already have the capacity to immunize children, but then also working with a number of other providers, even family docs, to make sure that they're positioned and resourced so that they can also vaccinate their younger patients as well. And so I think that this is going to be really important, but I think the question around how are we supporting parents and adolescents to make an informed decision, I think is really key. And I think it has to start from a position of empathy and really listening, sharing factual information. And we have a lot of guidance on our website at nyc.gov/vaccine, where we are supporting parents to have those discussions as well.
Yeah. Dr. Blackstock, and then Jairo, I'm going to come to you to give your view on how do we engage in this conversation around children being vaccinated 12 and above right now, but pretty soon children younger than 12, and how do we support parents and communities in making these decisions and really grappling with this information?
Yeah, I know it's encouraging to hear about all the resources that Dr. Easterling was mentioning that the health department has. I mean, I think what's really important, I was just doing some reading about this, and I think many parents feel like no one has reached out to them to ask what their questions are. So I think a big part of this is really understanding like what are parents concerned with respect to the vaccination and with respect to going back to school in the fall. Like there's still, many, I think the less answers that there are, the less specifics, and the less questions are being left the more questions are being left unanswered, that just raises people's anxiety. Again, issues of trust or mistrust come up or emerge. So yeah, I think that the main thing is just making sure that we're being responsive to whatever understanding first what the concerns are, and then being responsive to the concerns that parents have. And that's about like going out into the community, working again with community-based organizations, faith-based organizations, to do if there are town halls that need to be done to make sure that people are having answers to their questions that are satisfactory.
Yeah. Jairo, what are you hearing in Sunset Park from people about vaccinations for their children?
Well, we asked in the community assessment that we did, and 60% of the participants responded that they would actually vaccinate their children. They would really be open to getting their child vaccinated. 23% said they would definitely not be vaccinating their children.
Definitely not.
Not.
Okay.
So it's now trying to work with these families. And again, I think Dr. Blackstock mentions clearly that a lot of this relies on trust and the information that our families are getting. Who's giving it to them? Look, we, as Dr. Sterling had mentioned, there's hundreds of town halls happening a month at the moment, right?
Yeah.
We also hold community conversations, right? We try to make sure as much as possible to have doctors that look like the families that we are trying to engage. So we have 2 Mexican doctors who are regulars on our community conversations. We have a Honduran doctor who's also a regular on these conversations, so that there's an immediate connection and greater trust with when they start to hear that, oh, this doctor knows my town, knows the streets I used to walk at, and that begins to open up a better sense of, can I trust or not trust what I'm being told?
Yeah.
And last week we started a youth advisory group who's going to be informing us on the outreach we need to do with regard to engaging adolescents around this topic. When incentives came on, most of our community ambassadors are very young. They're 18 to 23-year-olds. And when I asked, what do you guys think about the incentives? And they were quick to say, yeah, those things are good for old people. We just happen to think you guys are trying too hard.
Huh, interesting.
And I thought that was an interesting take, and say, well, let's sit down and try to figure out how are we going to engage teenagers to
Yeah.
become open about getting vaccinated. What is it that they need?
Yeah.
And so we're going to be sitting, having a couple of conversations with some of these young people and let them tell us,
Absolutely.
what's the type of literature they need. Let them, we had a conversation last night about doing it a TikTok and let them do it. Brooklyn Community Foundation gave us the money to buy a fancy camera, so now they
Go
can
for it.
feel
I can't
they
wait to see
can
it.
they can feel they're doing something better.
Yeah.
But I think this is where we're at with regard to engaging teenagers. They're the ones who know the talk, know the walk. We
Yeah.
need to be able
And
to
they,
just
they know
give
it'll
them.
resonate with their peers.
We need to trust
Yeah.
that they will come up with the answers better than I will. Okay.
And to Dr. Easterling's earlier point and Dr. Blackstock's about these like health education models that we know work, peer education works, right? Having like credible messengers that you identify with, promoting these health messages, that's effective. I do have a question though, Jairo. You mentioned that on the survey, the community survey you conducted, that 60% of parents said that they would feel comfortable and they would like to vaccinate their children. It seems like that's higher than the response from community members on vaccinating themselves. Is that correct? Was there kind of a dissonance between those two?
There's some differences there with regard to the information that folks are getting. 41% of our families are on the fence. They're on the wait and see. They're waiting for more people to get vaccinated. Okay, for them to be able to see this. But a lot of our families are eager to have their children protected to go back to school. And they're connected to that piece. They see this connection immediately because many of them do not have childcare available to them. So the school becomes a safe place to leave these children at. And so getting their children vaccinated is one way of them having their children back in school. So so that's part of the conversation that we've been having with them also with regard to, what will make you feel more comfortable. No one consulted many of our parents with regard to the schedule. When they started doing these hybrid days, where they had some days in, some days out. Many of our families said no one ever called us to find out if this schedule would work, and it didn't work. So they want to be part of the conversation. They want to be consulted. They have pretty good ideas of how it would work. But yeah, if there is somewhat of a disconnect, part of it is, again, 41% said they were on the fence of the adults. 60% said they would definitely vaccinate their children, and a lot of it is connected to an opportunity to have their children go back to school safely. And so I think there's a lot of conversation that needs to be going on and held with them. Yeah.
I'm going to squeeze in one more question. And Jairo, I think this is more so for you, but I'm sure that others can chime in. Information was released recently that undocumented immigrants fear receiving the vaccine because of ICE. Is that fear still present on the ground in Brooklyn? What additional work is needed to reach these community members? Jairo, have you heard that?
We've heard that for outside of New York City, so not in Brooklyn.
Okay.
And a lot of our community has family outside of New York City. So we hear it from Long Island. And so folks are asking us if they could come to, Long Islanders could come to Queens to get vaccinated. We hear it from folks in Yonkers and White Plains if they could come into the Bronx to get vaccinated. We hear it from folks in New Jersey if they could come into Manhattan to get vaccinated.
Yeah.
Because of these fears that ICE is hiding behind some of these pop-up clinics in different places. Here, we've been working very hard at making sure that folks understand New York City is a sanctuary city, giving many of our residents the confidence that if they get a sense that something is not quite well, for them to raise the flag, for them to call us. I'm not much of a person saying let's report and let's try to find some way of crucifying some institution. But I've been telling all of them, look, if you walk into a hospital and they ask for your status, run and tell us, because that's the hospital we want to put in the news. That's the hospital we want to take everywhere and say, this is the institution that makes it unsafe for immigrants.
Yeah.
And speaking to immigrants with that kind of confidence makes them believe, yeah, they'll be protected. So we don't see it, we don't hear it as something that's happening in New York City. We hear it because folks are trying to come into New York City to get vaccinated because of that sentiment outside. So we hear it a lot, again, a lot in Long Island, Yonkers, White Plains, in New Jersey.
Thank you. It's reassuring that there's a sense of safety being felt here.
It is good to hear. I was just going to add, I think, and Jairo had mentioned this earlier, but I think our partnerships with consulates and houses of worship had also created a sense of security, because we're talking about places that folks go to already that they feel secure with going to, as opposed to saying everyone needs to go to a healthcare system or one of our city sites, but also partnering with organizations to do these pop-ups that really created a sense of security, particularly for undocumented New Yorkers. So I think that's really important. The messaging is one thing, but sort of creating that environment was really important as well. So thanks to all the work that Jairo has been doing.
And with that, I'm actually going to leave the last comment to a panelist that was not able to join us, but she was kind enough to send in some thoughts. So I'll let her have the last word. This is from Colette Peen, Executive Director of East New York Restoration Development Corporation. And she shared, our community needs conversations and direct outreach to overcome decades of health inequity. In responding to the pandemic, East New York Restoration is tabling out locations throughout the neighborhood. These pop-up health education events where we distribute masks, share information about testing and vaccination availability are being expanded by showing webinars such as this in the street. We are centering the conversation on the science and the message from our community health providers. In-person education and discussion to people who won't be on webinars will increase the reach of this event. So she's echoing the need for us to continue to engage in these conversations hyper locally, really meeting people where they are. The workers at East New York Restoration come from the communities they serve. So again, really trusting in that model of community ambassadors and credible health messengers. And again, it really touches on and centers on the issue of trust, which we have all acknowledged is critical to us doing this public health work. So with that, I really want to thank you all. And I'm going to share a little bit before we officially close about what is to come with our work at Brooklyn Community Foundation. The foundation is making both immediate investments in community health outreach and urgent needs, as well as community organizing, power building, and advocacy for policy change, which we talked a lot about on this panel discussion. As I mentioned at the top of the webinar, we've committed $250,000 for culturally relevant, medically accurate information, outreach, and navigation, including about vaccines, provided to trusted community-based organizations such as East New York Restoration Local Development Corporation and the Mexican Coalition. We are also providing $300,000 in continued support to organizations addressing urgent needs in community districts most impacted by the pandemic, including addressing food insecurity, lost wages, and combating anti-Asian bias and violence. We know that real change doesn't happen overnight, and that is why we're also investing an additional $2.5 million over 5 years for community-led advocacy and organizing to advance our collective vision for a fair and just Brooklyn. I'd like to extend once again my sincerest thanks to Jairo, Dr. Blackstock, and Dr. Easterling for joining us today. We are grateful for your time and expertise and all of the important work that you're doing. As I mentioned, our next phase of grant making will bring the Brooklyn COVID-19 Response Fund's total commitment to nearly $7 million. And we know that this work is far from over. For our Black, Indigenous, and other communities of color, barriers to quality healthcare, education, housing, and financial security will not disappear when the pandemic subsides. Real change doesn't happen overnight, and that's why we're investing in long-term structural change, and we're continuing to fundraise to make this possible. We know that change starts here and change starts with you. Please consider making a donation today to invest in a better future for Brooklyn at bcfny.org/donate. Thank you for joining us today for this conversation, and be sure to look out for announcements on additional webinars in the series by signing up for our newsletters and following us on social media at Brooklyn Foundation. Thank you all so much, and be well.